I'm Dr. Liseletta Schuster, and I wanted to talk to you about when people come in for nutritional counseling, and some of my patients as well when they're coming to me for a visit. We are recommending that they have certain blood tests done to assess their overall functional well-being. And I wanted to explain a little bit more detail about the tests and why we want you to have them done. So, when you call the office and we ask you about blood work, we are either having you go to your medical doctor's office to get certain tests done, or there's a lab that we are associated with. We send you there and they draw the blood, and then we get the information. And what we are looking for is a combination of something called a CBC. That's a complete blood count, and that's checking your red blood cells and your white blood cells. That's checking to see what your immune system is, if you're having a bacterial or a viral infection. Does it look like you have some kind of deficiency, either iron deficiency, folic acid, B12 deficiency, different kinds of nutrient deficiencies. It can tell, do you have any kind of parasites? Do you have allergies? Just from the complete blood count, the CBC alone, we can get that kind of information. Then we go on to a chem screen, and we do a very in-depth chem screen. So we're checking like your electrolyte balance, your adrenal health with your sodium, your potassium. We can also check to see, are you acidic or alkaline with your carbon dioxide. We want to also look and see how your liver and your gallbladder and your kidneys, what the function is there. We can also tell a lot with the cholesterol. If the cholesterol is elevated, and you also look at the liver and gallbladder, or you're checking the thyroid, because we check the thyroid as well. All those different things, the different systems are going to affect one another. We're also looking at what's called your SED rate and your C-reactive protein. It's extremely important. Those two check for your inflammation of your body, and there's other things too. If they're too high or too low, that will check to see if you're inflamed. So many important information that we are able to get from these blood tests have been invaluable in our practice. And I just wanted you to understand why we ask for what we do ask for. And I just wanted to give you a little bit of history as to how we started this. In 1989, I took some very incredible seminars from a chiropractor who had learned this information from medical doctors years before that. So this information has been out for a very long time. And what the information was looking at is, when you are going to the lab, even the lab that we are associated with, or the lab that your medical doctor is associated with, they have like the reference ranges that they're looking at. Like if you have your white blood cells, maybe they'll have the reference ranges of 4.8 to 10.8. So there's always the reference ranges. Well, the labs over the years, and even back then, they just kept on, those reference ranges kept on getting wider and wider because they would just continue to stick in the sick population. And so what those medical doctors did a long time ago was to really make a much more narrow, functional reference range that when I'm sitting down and I am evaluating each blood work, I look at the blood work as it comes through the office, I will sit down. I have this sheet here, and it has the functional ranges on the left, and then I write down what the results are. Then we put comments as to why it would be high or why it would be low, and really help a person to get on the right track with their health. And I just thought that you should understand a little bit more. There's obviously a lot more detail when you're actually sitting down and you're going through this with the nutritionist, and like I said, some of my patients also come in to see me for this as well. So I hope that that answers some of your questions. If you have any questions you'd like to ask me, you can email me or call me. And until next time, I'm Dr. Liseletta Schuster.